From our perspective, we think it's a matter of integrating across the NHS, so not just between primary care providers, but across primary, secondary care, all aspects of care. There's a huge amount to be drawn in, and there's the battle to ensure that there is a baseline of services really. Dentistry in some areas isn't fully computerised, so we still have quite some way to go to come up to the same level as some other areas of care. We would like to see the IT integration issue addressed in the final report. We'd like to see a means of government funding IT to make sure that records can be transferred across, again, not just primary and secondary care within specialties, but across the whole NHS. We think that that will have a huge benefit for patients to ensure that where they do have a particular issue, that's communicated between providers, and we can make sure that we're treating the patient holistically. For dentistry, we have a slightly different issue. Our funding is drawn entirely from the healthcare pot. So despite the fact that we do deliver some services that would historically be considered social care, we're entirely funded in a different way. So for us, it's been really interesting to hear the debate today, and of course, we think that as much integration as possible is beneficial to the patient, but we think possibly it's about making sure that expectations are set at the right level for patients to make sure that those who are accessing social care services in other aspects of healthcare get a standard service across, that they know how to expect services from dentistry as well. From today, we would very much like to see that we're raising the profile of dental issues, and again, that's making sure that we're treating patients in the round. We don't have good coverage in some cases of domiciliary care for patients, so if we can speak to colleagues today and make sure that they're aware of the fact that in dentistry money doesn't always follow the patient, that's a really important issue for us to address really. We want to see that, as I said earlier, that patients can expect a standard service across the board.